everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about hydronephrosis. And hydronephrosis is a condition where the kidneys become stretched and swollen. So you can understand that if there is swelling due to any sort of reason, what would happen? It would get stretched, right? So that's what happens exactly here in hydronephrosis. Now, the reason behind the swelling of the kidneys are, there is blockage of the flow of urine. So there might be blockage somewhere in the urinary system, and that's the reason there will be backflow of the urine from the bladder to the kidneys. So basically what we understood is that in hydronephrosis, there would be, there is blockage in the flow of urine. That means the urine is not flowing properly, right? So let us move to the definition of hydronephrosis. Hydronephrosis is distension and dilatation of the renal pelvis, usually caused by obstruction of the free flow of urine from the kidney, leading to progressive atrophy of the kidney. So what the definition is saying is that there would be distension and dilatation of the renal pelvis. So that means there will be accumulation of excessive urine. We can also see in the definition that it is mentioned that there will be, there will be obstruction in the free flow of urine, right? So the urine is not flowing properly. And also there would be distension of the renal pelvis, or there would be dilatation of the renal pelvis. So what happens in hydronephrosis is basically there would be accumulation of excessive urine in the renal calyces and in the renal pelvis. And you can understand, if the urine is not flowing properly, or if there is backflow of urine from the bladder back to the kidneys, then there will be definitely, a progressive atrophy of the kidney. Now, what are the different types of hydronephrosis? So it can be unilateral and bilateral. So it can be present in one kidney, or we can say it in both the kidneys. And then it can be acute or chronic. So when we call it as acute or when we call it as chronic, right? So we can we can differentiate hydronephrosis in these four different terms, that is unilateral, bilateral, acute and chronic. And among all these four types, the unilateral hydronephrosis is the most common type of hydronephrosis. Now next, let us move to the gradings of hydronephrosis. Now by gradings, we mean to say that in which stage the disease is. And for that we have different gradings, that is from grade 0 to grade 4. Now grade 0, we can say that this is a normal examination. In this we cannot find any sort of dilatation of renal pelvis. And then the next one is grade 1. Now you have to remember that I mentioned that there will be accumulation of excessive urine in the renal pelvis and the renal calyces, right? So in grade 1, what we can see is there will be mild dilatation of the renal pelvis only. So till here, the renal calyces are not involved. Then moving to grade 2. In grade 2, we can see moderate dilatation of the renal pelvises, including a few renal calyces. So what will happen here? In grade 2, we can see that few renal calyces would be involved, and in those there will be accumulation of excessive urine. And in case of renal pelvis, we can see a moderate dilatation. And then the next one is grade 3. So in grade 3, there will be dilatation of renal pelvis, and along with that, there will be visualization of all the renal calyces. So as I mentioned that in grade 2, you would be seeing that few of the renal calyces would be involved. But in grade 3, all the renal calyces would be involved, and there would be, uniformly, the accumulation of urine would be distributed uniformly. So in grade 3, whichever calyces would be visible, we can see a uniform dilatation among all the these calyces. However, there would be no changes in renal parenchyma. So, till grade 3, we cannot see any changes in renal parenchyma. And then the last one is grade 4. So, in grade 4, we can see similar appearance of grade 3. That means there would be dilatation of the renal pelvis as well as there would be dilatation of the renal calyces. But along with this thing, there would be thinning of renal parenchyma. So that is the difference between grade 3 and grade 4. Now next let us move to the etiologies of hydronephrosis. Well, the first thing is if there is any congenital abnormalities of the urinary tract or kidney. So that means this disease can be associated with any sort of other diseases. That means if there are any other congenital anomalies of the kidney or of the urinary tract which is present and because of that there might be hydronephrosis. And then if there is multicystic dysplastic kidney. The next one is ureterocele. So if there is ureterocele, again there is a chance of developing hydronephrosis. Then if there is posterior urethral valves and ectopic ureter and urethral atresia. Now along with these things there is also one more thing, that is there is an association with Down syndrome. So if a child is having Down syndrome, in that case the child might have hydronephrosis. So the child has increased risk of getting hydronephrosis. Now next let us move to the clinical manifestations of hydronephrosis. Now the clinical manifestations depends on the degree of obstruction. So we know that there is obstruction of free flow of urine. That means the urine is not able to flow properly from the kidneys to the bladder. So there would be backflow of the urine from the bladder back to the kidneys. So the signs and symptoms of hydronephrosis would depend upon the degree of obstruction, whether it is a partial obstruction or complete obstruction, or whether we have a unilateral obstruction or a bilateral obstruction, and also if it is acute or chronic. So all these things would determine the clinical manifestations of hydronephrosis. So first of all, in case of unilateral hydronephrosis, it is mostly asymptomatic, and there might not be any symptoms which would be presented in a child. So in some cases it might be asymptomatic. That means we cannot see any sort of clinical manifestations in a child with hydronephrosis. And mostly the unilateral hydronephrosis would, it's present without any symptoms. Well, in case if the child is having symptoms, in that case we can see pain in the renal area. So if there is excessive accumulation of urine, in that case we can see pain in the renal area. Then we can also see hematuria, and there would be urinary infection, and also along with that we can see dysuria. Then there might be renal calculi, as there is no proper excretion of the urine, right? So there is accumulation of urine. So there might be development of renal calculi, and also there would be azotemia. So as we know that the urine excretion is not happening properly, so that means there will be buildup of nitrogen products in the blood, and that is what is called as azotemia. And in case of higher grades of hydronephrosis, if there are large hydronephrosis, that can be palpable. Next, let us move to the diagnostic evaluation. So in diagnostic evaluation, the first thing that we would do again is history collection. So we would collect history, and then we would proceed for physical examination. Now in physical examination, what are the things that we can find out? So first thing is that there would be an enlarged kidney which would be palpable during the examination, and also as there will be acute urinary retention, in that case there would be palpable bladder. So the bladder can be palpable, and also along with that suprapubic tenderness would be present. So these are some of the findings that we can find out through physical examination. Next, we can do blood test. So in blood test, the creatinine level would be higher. And then we can also do urine analysis, which would help us to understand if there is destruction of nephrons. And through urine analysis, we can see higher level of pH. And then apart from these things, we can also do ultrasound. This would help us to, help us in visualization of the ureters and the and the affected kidney. So if there is presence of hydronephrosis, that can be ruled out through ultrasound. Well, these are the diagnostic measures that can help us in diagnosing hydronephrosis. Now, next, let us move to the management of hydronephrosis. Now, when we are talking about management of hydronephrosis, we have to remember what is our focus of treatment. So, here the treatment of hydronephrosis focuses on certain aspects. So the first one would be the removal of the obstruction. So we know that there is an obstruction because of which the urine is not able to flow properly, right? And that is why we are having all these problems. So the first thing is the removal of the obstruction. And then we also know that there is accumulation of urine behind the behind the obstruction. So because of the obstruction, there is excessive accumulation of urine. So that also should be removed, right? So the second thing is drainage of this accumulated urine from the obstruction. And then the third one is preventing infection. Why? Because the kidney is having accumulated urine, right? So the urine has not been excreted from the kidney, and that would also increase the risk of kidney infection. And we have to provide antibiotics, and we have to prevent the kidney function from this obstruction. Well, next let us see what are the surgical management that are there for hydronephrosis. So the first one is nephrostomy. So if there is an acute obstruction of the upper urinary tract, in that case this nephrostomy tube will be used. So here this is basically an artificial opening created between the kidney and the skin, which will allow the drainage of that accumulated urine. The next one is ureteric stent. So this is basically used if there is a chronic obstruction of the upper urinary tract, and this is treated basically by a ureteric stent which is inserted into the ureter to treat the obstruction. Next there is pyeloplasty. Now what is pyeloplasty? So basically pyeloplasty is a surgical reconstruction of the renal pelvis to drain and decompress the kidney. And then there is suprapubic catheter. So if there is an obstruction in the lower urinary tract, that is corrected by the suprapubic catheter. And apart from these things, if there is fetal hydronephrosis or congenital hydronephrosis, for that fetal surgical treatment is done for the correction of posterior urethral valve obstruction and also ureteropelvic junction obstruction. Now next let us move to the nursing management of hydronephrosis. So first let us see what are the pre-operative nursing diagnosis. So first there will be hypothermia related to infectious process, as we have already learned that there would be high chance of getting kidney infection because the waste product it's not getting excreted, right? So there is accumulation of the waste products inside the body, and that would increase the chance of fever. So there would be hyperthermia related to infectious process. Then there will be incontinence of urine. Also, there would be impaired nutritional status, less than body requirements, and then there will be high risk for urinary tract infection related to the obstruction. Then next we would see what are the post-operative nursing diagnosis. So in pre-operative nursing diagnosis, there would be infective airway clearance because the child will have the effect of anesthesia. Then there will be acute pain due to the surgery, and there would be also impaired physical mobility. Also, there can be risk for imbalanced fluid volume and risk for infection. Next, let us see what are the nurse's role in taking care of a child with hydronephrosis. So the first thing is that you have to educate the parents about the importance of taking adequate fluid. So they should understand what their child is or what condition their child is having, and for that condition what is the importance of adequate fluids. And then you should also educate them or explain them about the importance of notifying the physician of any abnormalities. So if they find out that their child is having any sort of abnormalities, the child might be unable to void, or the child might experience pain, or they might see hematuria. So all these things are really important, and you have to explain them that how important it is to inform the physician at earliest. And then you should also educate the parents about the early detection and the prognosis rate. So how early detection can help in early prognosis, that you have to explain them or educate them about. Well, let us conclude our today's topic. So today we learned about hydronephrosis, which means there is excessive accumulation of urine in the renal pelvis and renal calyces, and due to which there is distension or dilatation of the renal pelvis. So we learned about different gradings of this disease and what are the causes, what are the clinical manifestations, and also what are the management techniques that we have for hydronephrosis. So I hope you have got a better insight about the topic. Thank you.